Time right now is 8:20 on your Friday morning, and Prime Minister Justin Trudeau is focusing on Manitoba this week. Yesterday, as you've been hearing the news, he was at Red River College. That's where it was announced that hundreds of millions of dollars from the federal government will be put toward improving Manitoba health and long-term care systems. And I believe that the Prime Minister joins us now. Good morning.
Good morning, Marcy.
Thank you so much for being with us, Justin Trudeau.
Well, I'm glad to be on. Of course, what I am focused on right now, yes, the healthcare announcement was extremely important, but the death of Alexei Navalny has us all reeling, or the reports of his death. He was such a strong fighter for democracy, for freedoms for the Russian people. It really shows the extent to which Putin will crack down on anyone who is fighting for freedom for the Russian people. It is a tragedy, and it's something that has the entire world being reminded of exactly what a monster Putin is.
Can you tell me, Prime Minister, what questions you will be seeking upon hearing this news of Alexei Navalny dead at the age of 47?
Well, obviously, there will be questions about what exactly killed him, and our trust for the Russian authorities to be truthful about that will of course be not exactly strong. But there is no question that Alexei Navalny is dead because he stood up to Putin. He stood up to the Kremlin. He stood for freedom and democracy and the right of the Russian people to choose their future, and that was something that Putin was deeply afraid of, as he should be, and that sort of redoubles our resolve as Canadians, but as Western countries, to continue to stand up to Putin's abuse of the rules and his violation of international law and of human rights.
As you alluded to, we do have a lot to talk about around the healthcare announcement that you were here yesterday in Winnipeg talking about. I will go there in a moment, but our listeners actually have just heard something before 8 o'clock that I wanted to share a small clip with you. Play this for you. We've been doing this series on youth violence over many weeks in Manitoba here on CBC, and we heard from teenagers this morning. Our producer, CBC's Wendy Parker, and two teenage girls at a drop-in center. Neither of them go to school. Both say violence is a part of their daily lives. Here's what they shared.
Do you miss school?
No. Just prefer not to be in school. I had to grow up too fast to be in school.
What do you mean you had to grow up too fast?
I had to learn to take care of myself at the age of 12, man. I had to act 16 when I was 12.
And why do you say you've grown up way faster than you should have?
Because in the res I actually get to be a kid and do what I want, but here I can't be a kid. There can't be anyone watching me now. I gotta take care of myself. I gotta feed myself. I gotta get myself some clothes and shit. Like, I never used to do that in the res, yo. Now I gotta do that for myself. All of that. I gotta protect myself. Someone comes at me, I gotta fight for myself, you know?
Do you ever see a point, though, where you won't use violence, or you hope you don't need to react that way?
No. There's just always gonna be violence in my life.
Prime Minister, what can you do, your federal government at your federal level, to assist cities and provinces to address escalating youth violence to reach people like the two young girls we just heard from?
Well, first of all, no child should ever go through that. Not anywhere in Canada, not anywhere in the world, but especially not here in Canada. And it just shows how much we need to do more. We are failing our kids. We're failing Indigenous kids far too regularly in too many places across this country. There's two things we have to do. Obviously, we have to step up with more prevention. That's why, for example, the federal government has invested about $4.5 million for Winnipeg in the Safer Communities Fund to help fund youth organizations and work with them. We know, unfortunately, the previous Conservative government did a lot of cutting of youth programs, so now that we have a strong progressive partner in Wab Kinew's government, I'm really looking forward to digging in on this. We need to do more in reconciliation and make sure that we're supporting urban Indigenous communities where young people are overly victimized. We need to keep moving on C-92, which is the Child and Family Services Bill that allows Indigenous communities to take care of their own kids at risk and not see them sent to foster homes far away, raise them in culture and language in their communities, on the res, as she said, where they can be safer. And then we also got to do a better job of cracking down on organized crime and gangs, and that's something that we've made significant investments in recently, and we're going to do more.
With respect, you've been in government for some time now, where you can look at the past government and say they cut funding, and I respect that as well. But you're not.
I meant the Manitoba.
Oh, you're talking in Manitoba. Pardon me. Yeah.
Manitoba Conservative government. We've been there to invest. We've also we pushed very, very hard on the Manitoba Conservative government to move forward on harm reduction and safe supply to deal with some of the addictions crises. They, of course, were anchored in ideology, and I look forward to working with this government on a data and science-driven approach to actually help people at risk.
So if you're saying that the previous government in our province is part of the reason that we lost all those programs that would have helped kids at this stage, why at that stage as a federal government couldn't you have come in and said, no, the kids are too important and got more involved in our system to help kids?
Because we did to a limited extent, but unfortunately the federal government can't be the answer every time there is a conservative provincial government that slashes funding to social programs that the provincial government is responsible for. There are choices people have to make about the kind of society, the kind of world we want, and yes, a progressive federal government will be there to do things like investing in childcare, to invest in C92 to make sure the Child and Family Services are led by Indigenous people, leading on reconciliation. But if provincial governments get elected that turn their backs on all those things, there's limited powers for the federal government to react, which is why I am so happy we're now able to work with a strong progressive government that shares Manitobans' vision for a better, more united, and more compassionate society.
8:27 a.m. Prime Minister Justin Trudeau on live with us on CBC's Information Radio. Let's talk about the healthcare announcement. Earlier this week, Premier Wab Kinew actually said in Manitoba that, quote, the challenge is not money. We are spending more money in healthcare than ever before, and outcomes are getting worse. So simply spending more money is not going to be the answer, end quote. I know in yesterday's announcement it was about money, but it was also about targeted money. What are you expecting back from the province in order to solve the bigger structural problems that the Premier is, alluding to?
Well, the big change we made when we made announcements of $200 billion last year over the next 10 years across the country in healthcare systems is a level of tangible accountability and results to Canadians from provincial health systems on hitting targets and demonstrating that you're right, that the money actually gets used the right way. And that, quite frankly, here in Manitoba, there's a lot of catching up to do. And the provincial government's focus on fixing the healthcare system and starting with the people who work on the front lines in the healthcare system, supporting doctors, nurses, healthcare workers with the conditions and the resources that they need to actually be there to serve Manitobans is the right place to start. And the federal investments of close to $630 million is going to make a difference, with part of that going directly to long-term care and home care and support for seniors who we know are incredibly vulnerable. We're there to be a partner with the government that wants to fix the problems that have gone on for too long in the Manitoba healthcare system.
Folks across this country are able to access universal pharmacare and dental care. You're working in those systems now, but we've heard from a lot of people in Manitoba about the challenges about getting mental health care. I realize there was some money targeted to mental health care yesterday in your announcement. I wonder if your government is willing to fund federal coverage for mental health care at the same level as universal health care coverage. Is it something you're discussing?
Well, we know that mental health is health. That's why when we first got elected in 2015, we earmarked about $5 billion for the provinces on mental health care. Not all provinces used it as effectively as we would have liked, which is why when we came forward with these health care deals, we're putting very, very clear metrics and targets so that provinces will show that they are improving delivery of mental health care to citizens. That is absolutely essential.
I realize you have to go. We really appreciate your time on CBC. Thank you very much.
No, it's always a pleasure to be back with you, Marcy.
That is Prime Minister Justin Trudeau. He was in town yesterday for a series of announcements. If you want to read more, please go to our website, cbc.ca/Manitoba.